Many people in racial and ethnic minority groups are at an increased risk for complications from COVID-19. It's important for those at the highest risk to be vaccinated, but some minority communities may be hesitant. A Cleveland Clinic doctor says hesitancy is often rooted in a history of medical distrust and racial discrimination.
We have a lot that creates mistrust, but we have a lot also to lose by not protecting ourselves against coronavirus, because there's been a lot of morbidity and mortality in the Hispanic and African American community from it. So we need to ask questions, and once our questions are answered, we need to embrace this vaccine.
Some minority communities have higher rates of diabetes, obesity, heart disease, asthma, and other conditions. Many of these diseases are often risk factors for severe COVID-19 infections because people with chronic conditions have compromised immune systems and are more susceptible to infections. Dr. Goji says getting the COVID-19 vaccine may mitigate these risk factors and help prevent severe coronavirus disease. She adds when someone is vaccinated, they are protecting themselves, the community, and bringing us a step closer to ending the pandemic.
One of the things I can tell you as a woman of color is our communities, our faith-based missions, our churches are important to us. Getting this vaccine, slowing down the pandemic, shutting down the pandemic will help us go back to our normal lives.
Dr. Goji says vaccine hesitancy in minority communities should not be confused with being against vaccinations completely. She encourages medical providers to ask why when someone declines a vaccine. She says that they should then answer the questions and provide education about vaccinations.